Hi everyone, this is Russ Barkley, and this is part two of my video on the concept of a delayed executive functioning age in children and teens with ADHD. I created this second part because I've seen in the replies to the first video that there are a number of points that need some clarification, and so that's the point of this video. So let me get my PowerPoint presentation started here. There we are, and here we go. In the last video, I explained this concept that I created several decades ago to help parents and teens and teachers understand that a child with ADHD is not going to be functioning at the same level in their executive functioning and self-regulation as are other children and teens. So we want both the individual with ADHD to understand this, but more importantly, we want the people around them, their caregivers, to really understand this concept that you cannot expect people with ADHD during childhood or adolescence to be functioning at their chronological age in their self-regulation in the 7 different executive functions. So here's a graph that kind of illustrates this. Let's go into this a little bit, but I want to remind you, and I'll say it again later, don't worry about the numbers. The 30%, the differences I'll be talking about here, because that's not so important. That's not cast in stone. That's not some scientific fact. We're simply trying to convey an idea here about a delay and what would that mean for understanding people with ADHD. So here we go. This is a graph, let's say, a very poorly drawn one at that, of executive functioning in typical people from childhood up through most of their life. You see what's happening here. It accelerates rapidly during early development, ages 6, 9, 12, and so on. And then it begins to level off as we get out here at about age 28 to 32. That's when the executive brain, the frontal lobes, have completed their maturation. So we can't expect any further development or maturation once the brain has stopped maturing. It just makes no sense. So things are going to level off out here and remain so until our late 50s and 60s, when there's probably going to start to be a small decline in these executive functions, particularly in individuals who suffer from age-related cognitive impairment or one of the dementias and so on. Now let's take a look here. Here are people with ADHD. This is what the concept of a delay would look like, especially if we say that it's about 30%. And again, don't worry about that number. It fluctuates markedly based on severity of disorder. But have a look here. The gap here at about 5 or 6 is pretty small. It'd be about a 2-year delay. So a 6-year-old with ADHD is more like a 4-year-old typical person. Now, up here at 9, a 9-year-old with ADHD is more like somebody who's about 6 years of age. See, right here, I can draw a line from here to here in their executive functioning. So, and then out here at 12, you're more like somebody who's 9. At 15, you're more like somebody who's 10. At 18, you're more like somebody who's 12. Have you noticed something here? Although the percentage of the delay relative to your age is the same, it's 30%, the number of years you're delayed gets larger. That's what a percentile, or a percentage rather, means. So it may be a 2-year gap here when you're in early childhood, out to almost a 10-year gap when you're out here at 30. But again, it's not the number, it's the concept, okay? The degree of improvement in those with ADHD is not going to be the same as the degree of improvement in typical people. But there will be improvement. At 12, you're better than 9. At 18, you're better than 12. At 24, you're better than 18. At age 30, you're better than you were at age 18, and so on. There is improvement in everyone, typicals and ADHDs alike. But they're not maturing at the same rate of maturation. And at some point, when the brain stops maturing, things level off, and that's where the gap remains. Okay? So that's the concept. But once again, forget the numbers and remember the idea. There's a delay going on here. And as a result of that, we can't expect people with ADHD to function the same way that other people do. And we're talking here specifically about children and teens. So it's not the exact amount, it's the concept. Not everyone with ADHD is delayed to the same degree. As I said in my earlier commentary, the degree of delay I calculated ranged anywhere from 20 to 25% up to 40 to 45%, depending on the executive function, the measure, the age, and so on. So it's going to vary widely across individuals with ADHD. Obviously, those who have more severe ADHD have greater delays in their executive functioning than those with milder cases. Also, about 15% of children outgrow their ADHD by age 30. There goes the delay. Poof. None whatsoever after that point. Who are those people? We're not sure, but they tend to be cases that had mild ADHD in childhood, little, if any, comorbid disorders, at least average, if not better, intelligence, and resources that supported them. They may also have been people who took medication for several years or longer, because we know that in some people, medication can permanently improve brain growth in these executive regions. So that's an important point too. Not every component of executive functioning is delayed to the same degree. In some people, like me, it might be more of my nonverbal working memory, my spatial and visual working memory. In others, with better language development, it may be the same, or it may be that they have more problems with time management or more problems with self-organization. So it's going to vary a lot. We're not all going to experience the same delay in every one of the components because we're all different. So there's a lot of individual differences in our abilities. There's going to be a lot of individual differences in our executive function components. So knowing that helps us to understand this huge variability across people in the nature of their executive functioning and their deficits due to ADHD. They're not all identical, huge individual differences. The central point here is a concept for parents and teachers to understand that you cannot expect a child or a teen with ADHD to perform at their chronological age or similar to typical children of that age. So what do? We change our expectations. We lower them to match what we think our child or teen's executive age really is. And that's where the 30% rule might come in handy. So your 15-year-old has the self-regulation of someone about 10 or 11 years of age. Again, the numbers are not important. What's important is that there's a delay and you need to alter your demands, expectations, tasks, assignments, the environment to match where your child happens to be. How will you know where that is? When you make changes, you get improvement and the problems become less. Because remember, a lot of the conflict between parents and teachers and people with ADHD growing up as children and teens is expectations. If you expect too much, there's going to be a lot of conflict. Now, other clarifications. Some of you ask, can ADHD medications close the gap? Yes! That's why we tell you to take medication. The ADHD medications can improve or even eliminate these gaps, but only while the medication is in the brain. Different kinds of ADHD medications may not close the gap to the same degree of improvement. We know that the stimulants seem to produce a little bit more benefit than the non-stimulants. That's especially true for amphetamine-based ADHD meds versus the other meds like methylphenidate stimulants or the non-stimulant norepinephrine drugs like atomoxetine. They don't all achieve the same degree of improvement. They also don't achieve the same improvement across time. Some of the medications are 24/7, and others wear out within the same day. Also, let's understand that not all executive functions improve to the same degree on the same medication. We all differ in our drug responses. So again, huge individual variability here. And not everyone gets the same degree of improvement in their self-regulation. Research shows that when they're on medication, about 55% of children and teens are perfectly normalized. There are few, if any, differences between them and other individuals in their ADHD symptoms and so in their executive functioning. About 35% of cases improve markedly, right? But are not normalized. There's still that little bit of a gap there that we're going to have to make adjustments and accommodations and change our expectations in order to deal with that. That's why we combine meds with other forms of therapy and other ways of making accommodations for them. And then about 10% of people on a particular medication just don't respond to that medication, and we move on and try other medications. So don't expect everybody to be normalized, but notice a lot of people are. And that's very important to understand because in some people, all they need is medication. They may not need other treatments and accommodations, but most people will. And for most people, the combination of medicine with other psychosocial treatments is the best. Now, can executive functioning be improved in other ways in adulthood once that leveling off has occurred and that gap remains there? Of course it can, right? You can reorganize situations and tasks so that the executive deficits that you have are far less likely to impair performance in that situation. We can place ourselves in situations with more self-regulated people. I often hear ADHD adults say that the best thing they did in their job was to hire a more organized administrative assistant to carry out the tasks that they found to be so difficult for themselves. I've heard ADHD adults say they wouldn't be as successful as they are if they hadn't married somebody who's far more organized, if not outright neurotic than they are when it comes to organizing their home life and following up on the deadlines, the details, the paperwork, and the scut work of life. So by placing ourselves around better organized and self-regulated people, the person with ADHD can actually function a lot better. There's been no change in their brain. There's been no change in their executive function delay, but there's been a heck of a change in their performance and their outcome as a result of how they organize the environment. Also, another tip is to avoid things or situations that excessively challenge, if not overwhelm, your self-regulation. So that might be, for just as an example, if I'm very impulsive when it comes to eating things like donuts or brownies, don't bring them into your home. Problem solved. There's no problem with caving in to the desire to have that piece of food because it isn't there. Similarly, don't put yourselves in situations that are going to hurt your executive function. Drinking too much, using substances too much can really impair your executive functioning beyond what it was from just your ADHD alone. So I could go on and on about this, but the point is the same. We can avoid situations in which we have breakdowns in our self-control and as a result, not have those breakdowns again. Gee, what an idea, right? And then lastly is this idea that the executive brain deals more with time and novelty as well as with other people, but time and novelty. So the more we practice a routine, the more we make it a habit, the more we repeat what it is we're doing, guess what? In our brain, that behavior gets transferred from the executive brain to the automatic brain. And it's no longer a problem for us. So just think about this. When teens are learning to drive, driving places heavy demands on executive functioning during the initial learning curve because it's new and it requires a lot of coordination of information, rules, timing, so on. But after we have driven for 10, 15, or 20 years, driving is now being transferred from the executive to the automatic brain. So people with ADHD can drive following all of these habit patterns, and it's less of a problem for them most of the time. That doesn't mean their inhibition might not get in the way, their impulse control, that is, when it comes to speeding, when it comes to being impatient by situations that arise on the roadway. That can still happen. But the point I'm trying to make here is the more you practice something, the less likely you need your executive functioning to do it. So I hope that this clarifies a lot of what I saw as some misunderstanding or misinterpretations in the replies to my last video. So thanks for tuning in, everybody. I hope that you found the clarifications useful and that you'll tune in for more of my videos on this channel. Hope to see you around. Thanks and be well.